Now let's talk about the tumors of the canal, external auditory canal. We talked about the tumors of the auricle. So the external auditory canal, if you see here, this whole area extending from the auricle to the tympanic membrane. This whole area is the external auditory canal. So it's a long canal extending from the auricle, ending at the tympanic membrane, after which we have the middle ear, which is formed, which has the ossicles or the bones, and then we have the inner ear or the labyrinth. So these tumors of the external auditory canal we will talk about now. The first benign tumor of the auditory canal is the osteoma. This osteoma, it's a single, smooth, bony, hard, pedunculated tumor. So here, that's the site of the origin of the osteoma. It's usually single, and if you see, it's smooth, very smooth surface. It's single and it has pedunculated, means it has small stalk attached to it, and the origin of this osteoma is from the posterior wall of the osseous meatus near its outer end. So this is the site of the origin of the osteoma. Here the clinical presentation of the osteoma. So as the name shows, it originates from the bone and it's hard, smooth surface, and it's usually solitary, single, and it is pedunculated. Next, exhaustosis. Exhaustosis is another benign tumor of the auditory canal, and you see these are the multiple tumors, not like osteoma, which is usually single, solitary. These are the multiple. Here you can see multiple and bilateral tumors, and these are the exhaustosis. Smooth. They are also smooth like osteoma. Sessile, they do not have stalk or they are not pedunculated. So sessile, bony swellings in the deeper part of the meatus near the tympanic membrane. So they are in the deeper part of the auditory canal or meatus, close to the tympanic membrane, where the external auditory canal ends. This is the clinical presentation, and as you can see, they are the multiple, sessile, no stalk, and bilateral. Treatment of these exhaustosis is with high-speed drill. Drilling is important. They are hard. So to remove these, high-speed drill is used. Use of gauge and hammer should be avoided. So high-speed drill is used for the removal of these exhaustosis. Next, ceruminoma. Ceruminoma, as you already know, cerumen is the wax. So the tumor originating from these wax-producing cells are the ceruminoma. These are the tumors of modified sweat glands which secrete the wax known as the cerumen. Here, that's the picture showing the ceruminoma, smooth form, skin-covered polypoid swelling. Here you can see it's polypoid swelling. It's not rounded, it's polypoid swelling, and it's smooth skin-covered swelling. It obstructs the meatus, leading to retention of the wax and debris. You can see it's a big swelling, so it fills up the external auditory canal, and when it obstructs or fills, it means it can cause the obstruction and cause retention of the wax and the debris. That's the picture of the ceruminoma. Treatment is surgical excision and post-operative radiotherapy. chemotherapy. Sebaceous adenoma, another type of the benign tumor of external auditory canal, sebaceous adenoma. That's the appearance of sebaceous adenoma. It arises from the sebaceous gland. So it arises from the sebaceous gland. It is smooth, skin-covered swelling in the outer meatus. That's the clinical presentation of the sebaceous adenoma. So sebaceous gland is the site of origin of the sebaceous adenoma, and as you can see, it's big enough. It can also cause obstruction of the external auditory meatus, causing the retention or obstruction. Papilloma is another benign tumor. It's the tufted growth or flat gray plaque. Just like the papilloma of the auricle or pinna, it can be a tufted growth or the flat gray plaque. And the clinical presentation of the papilloma. So these are all the benign tumors of the external auditory canal. We have papilloma, sebaceous adenoma, osteomas, exostosis, and ceruminoma.